Good evening and thank you for joining us at Virtual Night in the OR. I'm your host, Stella Acquisto. I'm also a host with City TV, and an interesting fact, I'm a resident of Vaughan, so this hospital is super close to my home and I'm excited for that. Cortellucci Vaughan Hospital is a state-of-the-art hospital, and over the next hour, you're gonna get a chance to get a behind-the-scenes look at an OR. You're gonna meet some of the staff here, some doctors and some nurses, and after we wrap things up, you're gonna get a chance to ask questions and get some answers. We'd like to thank all of you guys for being here this evening, for taking the time to log on. Thank you to the Emerging Leaders Council for pledging to raise $1 million towards an OR. Thank you for that. Now, without further ado, we would like to introduce you to our CEO and President, Altaf Stationwala.
Thank you, Stella. Welcome, everyone, and thank you for joining us for tonight's very special event. I'm standing in the front doors of a new state-of-the-art operating room here at the Cortellucci Vaughan Hospital. If you can imagine, early in the new year, this hospital will open its doors and double access to care for our community. And this has never been more important as we work to contain the second wave of the COVID-19 pandemic. Never has it been more important and critical than it is today to increase capacity in our healthcare system. Soon, we'll have two hospitals that work in tandem to provide you with the care you need and deserve. Thank you to our incredible staff, physicians, volunteers, and importantly, our donors for your tremendous support. This has been an incredibly exciting and busy time as we prepare this hospital for patients in the new year. That includes making sure spaces like this one are ready when we open our doors in early 2021. And tonight, you'll get an exclusive sneak peek inside. Plus, you'll meet and get to know some of our top specialists and team members and have your burning questions answered. Thank you again for being with us virtually, and we hope what you see this evening will inspire you to join us in our final push to the finish line. I'll now send it back to you, Stella.
Thanks, Altaf. Now we're going to introduce you to Dr. Bowie, who's a Deputy Chief of Staff and a General Surgeon at Mackenzie Health. He's going to tell us about the surgical program, but also show us the OR. First, Dr. Bowie, we want to know a bit about you. I hear you have quite the playlist.
Well, Stella, I do, and I have to confess something, because when I started playing music in the operating room, I was playing 80s music like Bryan Adams, AC/DC, and I can tell you that some of us younger staff members had no idea what kind of music that was. So I went home and I asked my teenage son what I should play, and he had suggested the Mega playlist, which is a pop playlist with Justin Bieber, Shawn Mendes, Katy Perry, and I found that I was able to pull the team together so that we have a great time during the surgeries.
And I'm also hearing that you may have a few chickens running around in the backyard.
Yes, I thought I shared that in confidence, but I can tell you that this was something that we had started doing over the last year and a half. One of my patients actually brought in a chicken as a thank you gift for performing her surgery. So then the rest was history. And I can tell you the kids really enjoy the chickens. They're great pets, and they give you fantastic eggs, which we enjoy each morning. Now, that's what I do at home, but let's focus on why we're here tonight, which is the operating room. Welcome to my world. This is a great experience that I am thrilled to be here with tonight with my colleagues, Dr. Michael Kogan, a urologist, Dr. Chris Gallimore, an orthopedic surgeon. Now, before we get into the details of the operating room, I just want to give you an overview. As many of you know, in York Region, we are in great need of healthcare. We're one of the largest communities without a hospital. In fact, the population of York Region is growing. Families are moving here. Young people are growing up here. Our senior population is quite significant. In fact, over 30% of those that live in York Region and Vaughan area are over the age of 55. And if you take that beyond the next 20 years, that's a 35% growth. And over the next 10 years, that's a 135% increase in the senior population. What does that mean? The healthcare needs of this area will be greater than ever before. The timing of the Cortellucci Vaughan Hospital could not be any better. This is an exciting time We're able to create a new hospital designed from the foundation up through the lens of the patients. But what's really great about this hospital is the concept of a smart hospital. Tonight, you're going to see the smart operating room and what that means. Without spoiling too much for my colleagues, Dr. Kogan and Dr. Gallimore, I do want to mention 3 points. First of all, it's the integration of the technology from the anesthetic machine to the operating room table to our electronic medical records and to my minimally invasive equipment. This integrative technology has devices that work with us and technology that works for us. For example, on the outside of the operating room, you'll see an iPad that displays information about patients that's useful for me as a surgeon. We also have the capability of using 4K high definition system to look inside of you without ever opening you up. And this allows me to see tiny blood vessels, little minutiae in the anatomy, but it also sets the platform for a really cool idea of augmented reality, using computer systems and using technology like fluorescein to highlight blood vessels so that the surgeon can make the best decision at the most critical time. The exciting feature of this operating room is often what you don't see, which is behind the wall. This is an open concept space. It's about 3 to 4 times bigger than the regular traditional operating room. And you'll see that there are monitors that allows me to potentially bring in a virtual presence. I can bring in another expert surgeon. I can bring in my pathologist. It also allows me to show the images of my surgery to the surgeon next door if I need a second opinion. I can even show it to an expert across the world. So this allows us to greatly improve our collaboration so that we can enhance surgical care. But perhaps the most important feature is that this operating room will help us attract the best surgeons. I'm super excited to be able to recruit surgeons who are of the highest caliber, who can then provide the best care for our community. We have already started doing that. For example, one of our orthopedic surgeons, Dr. Rob Wang, does minimally invasive surgery in the shoulder, potentially bringing bone graft to help restore function. We have Dr. Aksoy from the Department of Gynecology that can remove a uterus that's diseased by just making small keyhole incisions. And then we have general surgeons like myself, Dr. David Weitzman, where we're able to remove your entire stomach without even cutting you open, curing gastric cancer. So the ability to recruit high caliber surgeon, I think, is one of the assets of this operating room. And it would be a wonderful opportunity for all of us to get involved in building a great surgical program.
Thanks, Dr. Bowie. Now that we've heard about the program and we've seen the space, let's throw things over to Heather Whitmore. Heather, what do you do here at the hospital?
Hi, Stella. I am the patient care manager for peri-op services here at Cortellucci Vaughan Hospital.
And we want to know a bit more about you. I hear you like jigsaw puzzles.
Yes, I do like jigsaw puzzles. I have done up to 1,000 pieces, and it does help me relax.
And we want to know more about your family. I hear that being a nurse runs in the family.
Yes, Stella. I have 2 daughters, 18 and 22. The 22-year-old has just finished and graduated university in the spring and just got her first nursing job a couple weeks ago. My youngest is 18. She's just starting year 1 university and doing online studies as well for nursing. So I guess you can say this runs in the family.
Tell us what the experience will be like for patients that come here to the hospital to do a surgery.
So here